Hello everyone. Today I'm going to talk about a very important and interesting topic about kidney cyst, also called as renal cyst. So let's find the difference between the complex renal cyst and the kidney cancer. When patient hears the word complex renal cyst, the very next thought it comes is, doctor, is this kidney cancer? And that fear is understandable. The word complex sounds dangerous. The word cyst sounds abnormal, and kidney is a vital organ. But here is the truth. Most complex renal cysts are not cancers. I am Dr. Shyam Varma, robotic urologist and kidney transplant surgeon. Here I am going to explain what makes a renal cyst complex, how do we differentiate between a complex cyst and a kidney cancer, and how to evaluate it further. The most important thing to understand is complex doesn't mean cancer. Complex simply means the cyst does not look like a simple water-filled sac or a cyst. It is a description and it's not diagnosis. Doctors do not label cyst as cancerous or benign based on one word. They look at specific imaging features and the patterns. So what makes a cyst complex? A simple cyst is like a clear balloon filled with water, and a complex cyst may show one or more of the following features like thickened walls. There might be internal partitions or called septations. There might be calcific deposit or calcification. There are areas that look solid and the irregular shape. These features certainly raise questions, but they do not give answers by themselves, and that is why further imaging is often advised. So an ultrasound is not enough alone. Ultrasound is definitely an excellent choice for detecting cyst. It has its own limitations. It cannot always distinguish the fluid from solid tissue, cannot assess the contrast enhancement, and cannot reliably assess the cancer risk. So when a cyst looks complex on ultrasound, the next step is usually a CT scan or an MRI with contrast. This is not because cancer is suspected, it is because clarity is needed. The more information is needed. Now there is something called as Bosniak classification on CT scan. So to standardize the decision making, doctors use the Bosniak classification. You don't need to memorize this, but the understanding is required to reduce your fear. So Bosniak 1 is a simple cyst which is completely benign. Bosniak 2 is a mild complexity and is still benign. There's something between 2 and 3 called Bosniak 2F. It carries a low risk to the malignancy, and follow-up is advised. Now comes the Bosniak 3, which is intermediate, a higher risk for cancer and needs close evaluation. After that is Bosniak 4, which has a high suspicion for cancer and often treated as cancer. So most cysts fall into Bosniak 1, 2 and 2F and do not carry high risk. What Bosniak 2F really means, because that's the one which is a gray zone. The Bosniak 2 carries most anxiety. The patient fears about follow-up needed and they assume that is the worst thing. It might turn into cancer. But in reality, the 2F cysts have low cancer risk. They remain stable for years and may even regress sometimes. So F stands for follow-up, and hence we ask 2F patients to follow up for imaging to ensure that the cyst does not change, not because cancer is expected. How kidney cancer actually looks different. So there are certain features where we say renal cyst is different than the cancer. It behaves differently from the cancer. Typically, the cancer features are, it may be a solid enhancing component, they can have irregular borders, the growth rate is faster, and there is distortion of the kidney architecture. Cancer rarely looks like a simple fluid-filled structures. So if it's simple, don't worry, it's a benign. So do all complex cysts need surgery? Absolutely not. Most complex cysts, they are monitored, they do not require surgery and may never harm. Surgery is considered only and only when the imaging shows stronger cancer presence or feature, the cyst grows or changes significantly, the symptoms develop, and the risk clearly outweighs the observation. So modern medicine avoids unnecessary surgery whenever possible. Why watchful waiting is safe? Patients often worry, what if we miss cancer by waiting? This fear is again understandable, but misplaced. Kidney cancers usually grow slowly. They are detected early through a follow-up and are highly treatable when localized. So a structured surveillance program is not a neglect. It is a controlled evidence-based monitoring. There are certain common myths that can create panic about complex cyst. So let's clear some common myths. Myth 1. Any complex cyst is cancer. It's false. Myth 2. Biopsy is always needed. Not always helpful, or rather I would say safe in cystic lesions. Myth 3. Surgery is safer than waiting. Surgery has its risk and is not always necessary. So fear-based decisions often cause more harm than benefit. So what patients should actually do, what should they avoid, or what they should ask when told you have a complex cyst? Ask what Bosniak classification it is. Ask whether the contrast imaging is done. Ask about the follow-up intervals and ask about the growth patterns. Do not demand surgery. Do not assume it's cancer and do not ignore follow-up. So talking about the prognosis, the overwhelming majority of renal cysts, including many complex ones, never become cancer. Even when kidney cancer is diagnosed, it is often early, it is highly treatable, and the outcomes are excellent. So modern imaging allows us to separate harmless findings from dangerous ones with remarkable accuracy. So what's the take-home message? The most important message here is complex renal cyst does not equal cancer, but complexity definitely prompts further evaluation. So when it comes to kidney cyst, knowledge is far more powerful than fear. I'm Dr. Shyam Varma, robotic kidney transplant surgeon and laser urologist. If you found this video useful, kindly share, like and subscribe. Thank you.